The video demonstrates step-by-step removal of volar distal radius plate after fracture healing. The patient is positioned supine, surgical side on hand table. After standard preparation, the previous volar scar is identified and used as then approach. Superficial incision is given directly over previous scar. As this is the reoperation, the tissue plane will be less distinct than during the original fixation. The dissection proceeds gradually with careful handling of the scarred soft cutaneous tissue. Tension the both sides of the incision and use a blade for easy and safe opening of the scarred tissue. As the incision is deepened, you can see the FCR tendon being exposed. Take down the fascia above the FCR tendon using myocisor. Here, mobilization of FCR tendon might be difficult due to adhesion from the previous surgical scar, so clear the adhesion first and retract it medially. There will be vessels from radial artery crossing the surgical plane. Identify and cauterize it to make your life easier. Opening the deep fascia will directly lead to a hardware proximally. I prefer using blunt dissection to reach the implant using gradual rubbing with gauze piece. But distally, story is different. Here, the plate is covered by pronator quadratus. Give a sharp incision with a blade to remove the pronator quadratus from operative field. Use cautery to remove all the soft tissue attachment to plate and screw. And make sure to clear the scar tissue off the screw head properly. If the scar tissue remains inside the screw races, the screwdriver may not sit properly and the races can be damaged. Once adequately exposed, the appropriate screwdriver is engaged and kept aligned with the screw axis. The screws are removed subsequently. If a screw does not turn freely, I first improve the exposure, clear the screw head, and re-establish proper driver engagement. This is particularly important with locking screws. Once the fixation is released, the plate may still be held by the fibrous tissue or scar. These attachments are gently released under direct vision. If plate is stick to the bone, use a flat instrument like scissor blade to disengage it. The plate is then carefully mobilized and removed from the distal radius. After removal, remove all the soft tissue overgrowth using nibbler. The operative field is thoroughly irrigated and hemostasis is achieved. Few stage suture for deep fascia is applied, then directly close the subcutaneous layer. Then the skin is closed in mattress fashion. This was a complete demonstration of Volar distal radius plate removal. For more practical orthopedic surgical techniques, subscribe to Orthopedia.